All right, everybody. Thank you so much for joining me today, Mr. Buckler, with another sit-down interview of a medical professional. Today, we've got Kristin Hwang, speech language pathologist, with us. Kristin, thank you so much for joining me.
Yeah, thanks for having me. I'm excited to talk about a little bit about what I do.
Yeah, and I'm genuinely excited too because there's a lot that I don't know. Um, Really probably the full meaning of what you do, even the title, let alone how you do that in the day to day. So I'm excited to hear those things as well as my students hearing those things too.
Yeah, of course. Yeah, I'm excited to share.
Yeah. So let's just start right there. Like, what is your job?
Yeah, so my job as a speech language pathologist is, in a nutshell, I help people communicate and I help people with eating and swallowing. So, really, with my job, what I help people with the big nine disorders. And so, in my field, the nine disorder categories that we treat and assess are speech disorders. So if you've ever heard the term of like speech impediments, where people say, oh, I can't say my R sounds, or I can't really say my S sounds. We help people that have speech sound disorders. We help kids that have things called language disorders. So maybe if you have ever had friends or siblings that you know growing up that maybe were late talkers that didn't say very much and were a little bit behind in learning words and saying words, that would be a language disorder. We help kids with fluency disorders. So, stuttering is an example of one. Voice disorders, so any kind of vocal nodules or any kind of different vocal disorders we deal with, and we help treat. Kids with feeding or swallowing disorders is a big one that we actually do treat. Um, we also work with people that have social communication disorders. So sometimes there are people that are on the autism spectrum disorder that maybe they don't pick up social cues like you and I would. And we actually help those individuals learn kind of some of the social cues and things that we know on a regular basis. We help cognitive communication disorders. So we treat people that have traumatic brain injuries or dementia by helping them with their critical thinking skills and their executive functioning, as we like to call it.
Mhm.
We also help with setting kids up with augmentative alternative communication devices. So, if you've ever seen, sometimes the movies have been picking it up these days, but for patients that may be nonverbal, we actually help teach them how to communicate using a different speech device. So sometimes that might look like an iPad, or we even have some computers where you can actually communicate using your eye gaze. So, using your eyes to select different icons so that you can communicate to other people, which is really cool.
Wow.
And then the last kind of category that we work on is early intervention. So, just kind of preventative measures for kids that might be more at risk of getting a speech or language disorder or feeding and swallowing disorders. We try to make sure that we get on board early. So, in a nutshell, that's a little bit of what we do, but it's a pretty broad group of people that we work with.
Yeah. Yeah, that's incredible. Like the number of different things that fall under that that I've interacted with personally in my childhood. So I couldn't say my S's when I was growing up. And so
Oh,
my
really?
sister, her name was Sarah also, and so I couldn't say her name, so I call her Raw or Raw Raw because I couldn't say my
Really?
S's. That's all I could say.
Yeah.
Um and then with Evie, our oldest daughter, who had some swallowing issues growing
Hmm.
up after being in the NICU for so long and interacting with folks like y'all as well. So that's so cool
Yeah.
to hear how like that. I didn't know that I dealt with speech language pathologist as well.
Yeah, you did. It sounds like you had some personal experiences.
Yeah, yeah, that's really neat. So with this like really broad like spectrum of different tasks and roles and stuff, what was your educational journey like to getting to where you are now?
Yeah. So after high school, once I graduated from high school, I went to college and I got my bachelor's degree. So I got my 4-year degree in communication sciences and disorders. So that was what I got to study. And then I got a minor in psychology. And a lot of people that go into communication sciences and disorders are usually become a couple different things, but most people that go into that either want to be audiologists or speech language pathologist. And then I have a couple friends that actually went on to do interpreting for sign language. So they became sign language interpreters.
Mm-hmm. That's neat.
Um, and then after I got that bachelor's, then I went and got my master's. So I went an additional 2 years and got my master's in speech language pathology. And then after that, I had 9 months of what we call a clinical fellowship year, which is essentially just, if you kind of think about it, we still have training wheels. Like I'm still able to treat patients, but I have a supervisor that is with me, working with me and making sure that I'm getting the workflow, that I'm treating patients appropriately, and that I'm adjusting to being a therapist on my own.
Mm-hmm.
And then after all of that, then we finally get to get licensed.
Nice. Yeah,
Yeah.
that's really cool. I hope to we'll probably dive into the a couple of those aspects a little bit more for sure. Um, but in general, so like you said, like lots of different steps along the way and a lot of different roles as a speech and language pathologist. Why? And you mentioned this right at the beginning too, is kind of an unknown sort of like career. W- Why did you choose to become a speech language pathologist in particular?
Yeah. Well, actually, when I first went to college, I wanted to be a nurse. And so I started with a lot of nursing courses.
Hmm.
And the more that I thought about what I wanted to do in my career, um, the thought of having to work a night shift did not appeal to me. I like my sleep and I like to be awake during the day.
Yeah.
And I wanted something where I could work 8 to 5 and have some flexibility.
Hmm.
And so the nice thing about speech language pathology is you can work with birth, like infants and neonates, all the way to adults, like in geriatrics. So you could pretty much work with any kind of population. And
Hmm.
the other nice thing about the field is that it's really flexible. I can work in the schools, I can work in a hospital, I can work in a private practice, a rehab center, a skilled nursing facility, I can do home health.
Hmm.
So the nice thing about the career and the reason that I really liked it is my mom was a speech pathologist. And when I decided not to go into nursing, I was trying to think about a job that helped people, that was a helping profession, but also that one career that had a lot of flexibility because I get bored really easily. And so being able to kind of have some flexibility in my career where I can work with adults or pediatrics or work in a variety of settings was something that really appealed to me.
Yeah. That's great to think of the practicality of things for my students, like when they're thinking through what careers they might want to do, think practically, but then also think like preferences, like the logistics, like having to work night shifts. Yeah,
Yeah.
there's jobs that I turned down as well. That was the breaking point. Is like, no, I really do love my sleep as well, and that's just a very practical thing. But it's something that like in every career you've got to be mindful of as well.
Yeah, absolutely.
Yeah.
For sure.
Yeah, I think for my students it's a lot of feelings and dreams, and those are great to have, but then also of having like a plan with those dreams, and choosing schools to go to and whatnot as well are really helpful things to do.
Yeah, and we'll probably talk a little bit about it later, but also knowing what some of your spiritual gifts are
Mm.
and knowing and paying attention to the gifts God gave you and knowing how to hone those in a specific career. And one of the things that I really loved was having relationships with other people and reaching out. Um, to others. And yeah, I definitely knew that a helping career was something that I specifically wanted to go into.
Yeah. Oh, I think it's helpful too. Like you were talking about how this kind of field is flexible, but you also being flexible and having that flexibility to change in college from nursing into speech pathology, but then also like to be willing to be flexible if other things come up
Yeah.
as well in your career. That goes a long way in any career, whether my students go on into medical or not, to be flexible, to have that flexibility, it goes a long way.
Yeah. It's definitely important to be flexible. That's a good life skill to have.
Yeah, for sure. So probably this probably more than I understand segues into the next question, but what is a typical, and this is a key word there, typical day look like for you? Probably a lot of
Uh,
flexibility, I'm sure.
yeah. So I currently work at Erlinger Children's Hospital. So I work in a hospital setting. And my day to day looks a little bit different every day, but the things that are the most consistent are I usually start my day going in, clocking in at 7:30. And then I usually start seeing patients either at 8 o'clock or at 9 o'clock. Um, Usually, I spend the mornings after I clock in. I try to chart review my patients and just try to remember who they are, what we've been working on, what kind of activities or strategies or tools that we need to talk about during our sessions. And then if I see patients that come in on an outpatient basis, which just basically means that patients come into my office and work with me. When I see my outpatients, they'll come and visit me, and I usually spend one on one time with my patients for anywhere from 30 minutes to an hour. And I usually see my patients either every week or every other week or once a month. Sometimes the frequency of how often I get to see my patients varies depending on their diagnosis and depending on the severity of their diagnosis and what we're working on.
Mhm.
But I'll usually treat people back to back, and then I usually have a lunch break for an hour, which is really nice. And
Mhm.
then I see a couple more patients, and then I'll usually have to document anything that you go into with medicine or any kind of medical career you do. You will have to spend some time documenting, which isn't that bad, in my opinion. But yeah, so that's typically what some of those days look like. And then on other days, I do something called a swallow study, which means that I actually get to go down to radiology and I work with the radiology techs, and I actually have kids come in and do a test where they drink barium, and I watch them swallow under X-ray.
Mhm.
And so that is really cool, but that's something that I get to spend some time doing, and even going up on the floor and helping feed babies with bottle feeding. Like I said, we work with neonates, so a lot of us will go in the NICU, and when babies are finally cleared to start drinking from the bottle, we're usually right there with the parents, helping them with their first bottle feed, which is always really fun. It's always a really big milestone for a lot of
Mhm.
parents. Um, so yeah, it's typically what the day looks like is getting started, chart reviewing my patients, seeing them, treating them. And the cool thing about my job is I get to see my patients a lot more frequently than like a doctor would.
Mhm.
So um, a lot of times I see my patients, some of them weekly, and so I really get to know and build relationships with them, and I get to learn about their pets and their
Mhm.
favorite foods and their favorite TV shows. And they get to learn a little bit about me too. So it's always really exciting because I feel like I really get to know my patients on a deeper level.
Yeah, that's pretty unique from like other interviews, medical professional interviews that I've done in for these series. Like that's pretty unique to where, I mean, probably the most frequent is um, a PA I interviewed for family medicine who may see his patients 6 or 12 months out of the year, like within that span every other 6 months or 12 months. And so this is pretty unique to be able to have those relationships, yeah, and then and to really get to know the people goes way farther in treating them, I'm sure, and building that rapport and so on.
Absolutely. Yeah. I feel like I can look at a patient's name and I could tell you um, everything that they like, all their likes, all their dislikes,
Yeah.
which is really unique. And I
Yeah.
really like that about my job.
Yeah, no doubt. That's really neat. You've touched on this a little bit, and I think we can segue really easily into it because you mentioned a couple of things earlier, and then you mentioned something right now. But like, what kind of body systems, as we are like now in the midst of learning about the human body systems, what body systems do you help with these people, kids, neonates, as you said, all the way up to older folks as well? What specific body systems do you help with in your job?
Yeah, I would say the nervous system is a big one. So the brain and the nervous system control a lot of communication, a lot of thinking and swallowing. Your respiratory system, because if you think about it, breathing provides a lot of airflow that you need for speech and for voice. And even feeding and swallowing. We do a lot with the digestive system. So whenever you're swallowing and eating, we do a lot with that. We deal a lot with the auditory system. So hearing plays a really important role for speech and language development.
Mm,
And, that's something that we have to really focus on.
mm,
And then I would just say the articulatory system. So, like your mouth, your teeth, your tongue, so your lips, your voice box, or your larynx is typically the common name that we use for it, but your
mhm,
voice box. So,
mhm.
all of those systems are what we kind of focus on.
Yeah. That is interesting, you talking about auditory of like hearing and how impactful that is for language and even personally speaking, and how impactful that is and the cooperation between so many systems, nervous system coordinating it all, but then other organs and systems executing those functions as well. Pretty neat to think about.
Yeah, and it all works together very closely.
Yeah. Yeah, that's been a very clear recurring theme in every single interview of how interconnected the body systems are. Like if one is out of whack, like just hearing, um, like how other things follow, digestive system and how other things follow. And so, yeah,
Yeah.
that's interesting. And I'm sure, especially for you in your role, we talk about this a lot. I tell my students, we'll probably say this phrase 1,000 times in this second semester as we're going through things, but like how structure determines function and it's how, like for a lot of things that you do, the changes in structure change function a lot. Um, was it's
Definitely.
like is there a specific case where that's like very clear? Because I'm always looking for examples to give my students on
Yeah.
that, but
So in my career, we work a lot with kids that have craniofacial disorders. So if you think about it, cleft lip or cleft palate,
mm,
which would mean that maybe you have like a gap in your philtrum right here or
mhm,
in your hard or soft palate. And so whenever you have a gap in your cleft lip or cleft palate, anytime you have a gap there, it impacts your breathing, but can also can impact your voice and your resonance.
mm,
So a lot of times kids that have cleft lip or cleft palate, we have to do a lot with speech therapy because a lot of their sounds aren't quite right because a
mm,
lot of their pressure consonants that we use that we have to use our lips for,
mhm,
like if you think about it, the B or the M sound, you have to have lip closure
mm,
to or B. And they
yeah,
aren't able to get that lip closure with their structure.
mm,
So a lot of that impacts the function of their respiratory systems, their articulatory systems, and just that is just one example that I can think of off the top of my
yeah,
head. Can even
no,
impact like feeding too.
yeah. Yeah, that's a fantastic example. I don't want to steal it because I want to stay in this video. I want the kids to see it, but like that is a fantastic example of that that I wouldn't have thought of. Yeah, how very clearly structure determines function or can change function if the structures is harmed or not formed correctly to start with. Yeah, wow, that's neat.
Mhm.
Um, So I think that this next question is probably the most obvious out of just about everyone that I've asked because there's a lot of kind of therapy involved in the work that you do. But and maybe you can elaborate more on this. But in what ways have you been able to be a light or like minister to others in your job and what you do on a day-to-day basis?
Yeah, I feel like that's a really big question. And I think the biggest thing is a lot of people that have any kind of communication disorders are usually really in a vulnerable place. They
Mm,
can be really discouraged or embarrassed. They can be really frustrated when they're not able to communicate their basic wants and needs. And so I think the most important thing is showing them patience and respect, and just showing them that they're valued.
mm,
I always think about like Psalm 139:14, where it talks about like being fearfully and wonderfully made
mhm,
and wanting to treat every patient that they're capable and that they're worthy. And just looking at them as more than their diagnosis
mm,
is is the way that I try to go about treating a lot of my patients. And ironically, I feel like I see a lot of the Lord working in the way that I interact with my patients, more so that sometimes I feel like a lot of patients are alike to me.
mm,
Um, I just we realize how much that we take for granted. And I can think of working with patients that have had a stroke, and the only thing that they want to do is they want to learn how to say "I love you," so
mm,
that they can tell their grandkids that they love them.
mm,
Or I remember working with a gentleman who was about to get married and he wanted to say his wedding vows,
mm,
but he ended up having a stroke. And so it made it a little bit harder for him to be able to say his words. And so, working with him specifically on writing, which is also a form of communication that he had an impairment on,
mm,
I helped him write his vows, and we practiced working on saying his vows for his wedding day.
mm,
But I feel like you see little glimpses of the Lord using these patients to really be a light and reminding me of like, wow, like look at just the compassion that these people have for others in their life and how they
mm.
want to use their communication as a platform to serve others and love on others. I even had a pastor who I worked with. And if you think about it, like a pastor, you are up on the pulpit, like preaching the word of God every Sunday. And
Mm,
like if your communication's impacted, that's your career, that's your calling, that's your ministry.
mhm,
So there's been a lot of people along the way where I feel like they've actually been a light to me, and it's been really humbling.
mm. Yeah, that's amazing. Like, just really, really awesome stories to hear. Um, how you've been a blessing to others, and then also how they've been a blessing to you as well. That's an encouraging thing, and I think that was something that my students can look forward to in any career they might end up being in, but particularly like in your career specifically for sure.
Yeah.
Um, So thinking about my students, right, thinking about their careers, is there any advice that you give my students who right now, seventh grade, many of them don't know what they want to do, and that's fine because it's seventh grade.
Sure.
Um, but do you have any advice for my students that are considering what they want to do when they grow up, maybe specifically to be a speech language pathologist or just a grown up in general? Any advice for them?
Yeah, that's fair. I think the most important thing is like seek wisdom. Shadow people, volunteer, gain exposure to careers that you think you might be interested in, or
Yeah.
even careers that maybe like aren't even on your radar.
Mm,
Just gain exposure and ask questions. Ask an adult. Ask like family friends.
yeah.
That's always important. And then I would say I mentioned this earlier, but just pay attention to the gifts that God has given you.
Mm,
Everyone has different abilities, and so kind of recognizing some of those things that you might be better apt towards, or some of those gifts that you might have can maybe help kind of guide you into at least a field or maybe an idea that you might like. Some people love helping others. Some people love building or fixing things. Some people are creatives and they're really artistic.
Mm.
But thinking about what you're good at can kind of help lead you to things that you're passionate about. And something that's important when thinking about your career is there's always going to be pros and cons no matter what you choose.
Hmm.
Every job comes with cons.
Mm.
And so you kind of have to think about like what career is it where the pros will always outweigh the cons,
Mm.
because the cons will always be there. But where are the pros going to be and what are things that I'm passionate about?
Yeah.
Because if you're passionate about it, then you're going to be more likely to enjoy what you do.
Yeah. Yeah. That's a that's a fantastic word. I hope my students hear that and that resonates with them. The lean into the gifts and the blessings that God's already given them. And knowing my students, that they've got fantastic and wide, diverse gifts that hopefully they'll cultivate through school, but then also out into their careers as well. That's an encouraging thing. All right, well, I always like to end these interviews like I did with Alex, 2 years ago, wherever this was, with some sort of a question that deals with you and your middle school experience. And so, my question for you this time is, what was the best part of middle school for you?
Yeah, the best part, that's easy. I liked being on like sports teams and being able to join clubs
Yeah.
because I feel like in middle school, that's kind of when you start having more like clubs that you can join at school, whether it's like Bible club or any kind of academic club that you're interested in. And I just liked finally being able to be independent and choosing what I was interested in, and
Mm.
then finding other people that had similar interests to those. And being on sports teams together, like those were kind of the best times of middle school, was just finding your people, finding community, and people that were like-minded or had similar interests.
Yeah. Yeah, I think back to my middle school days too, it wasn't like the academic things that I learned or experienced. It was the people that I was around and the social interactions. For better, for worse, thankfully the Lord got me through middle school and from my own sinfulness and stupidity as a middle school boy. Um, and but still like those friendships and experiences, like you're saying too, a little bit more freedom in middle school to be able to make those choices for teams and clubs and stuff. And
Yeah,
yeah, that is a highlight. There's a lot you could focus on in middle school as a middle schooler listening
definitely.
in, like all the drama and the social things that like get so heightened because it's middle school and there's so many things. And
Yeah.
those are real, but they're not lasting. They're not going to change. They shouldn't, let's say this way, shouldn't change your life forever. Um,
Mhm.
and an encouraging word to continue on through those and to look back because I mean I'm sure we both went through craziness in middle school, but to look back um, with joy and reminisce on the ways that we got to experience fun things in middle school. So
Yeah, no, yeah. Middle school's a time. It
yeah,
can be hard, but it can also be fun. And
yeah,
usually, like the hard things, I feel like I always tell myself, like 5 years from now, will that actually matter?
yeah. That's the thing. Yeah, it's just middle school. Like, yes, you've got to get grades enough to pass to the next grade, but like it's still middle school. Not I don't know any colleges that are hunting down middle school transcripts and wanting
Yeah,
to see
no.
exactly how you did on these things. And so
Yeah,
yeah,
yeah.
just have a good time, work hard, build those skills, and hone in those giftings, and do it all for the glory of the Lord. So
Yes,
yeah.
absolutely.
Man, Kristen, thank you so much for joining me today for this interview. This has been fantastic. I have learned so much, and hope my students have too. This has been a joy to hear from you and to get to know a little bit more about you and what you do as well.
Yeah, thanks. I'm like really excited that you asked me to share. I feel like the field of speech language pathology is really small
Yeah,
and a lot of people don't know it exists. And so when I get to share about it or have a platform to spread more awareness of what we do, it's always greatly appreciated. So thanks
yeah.
for having me.
Absolutely. This has been fantastic. Well, thank you so much again. It's been great.